Do you want to improve patient outcomes? Do you need help integrating rehab into your safe patient handling and mobility program? Are you looking for value-driven solutions? Then the Universal Mobility Coach system is for you. Maximize patient mobility, optimize safety, improve quality, and maximize value. Therapists face unique challenges in handling patients. The role of safe patient progressive mobility is key. The American Physical Therapy Association Vision Statement 2020 is to transform society by optimizing mobility to improve the human experience. Our patient here, Helen, is so fearful that she gets about 5 steps in 10 minutes. Evidence tells us that we should be aiming for hundreds of repetitions. Helen is very anxious, and both she and her therapists are exhausted by the end of treatment. Fear and anxiety are paralyzing agents. The Universal Mobility Coach system is the solution for therapists to maximize the use of their safe patient progressive mobility equipment to really optimize mobility for each and every one of their patients across all environments of care. Consider Tom. He is in a lot of pain and has a lot of anxiety around moving because of his pain. So much so that a young, previously active young man becomes a risk for falling and for caregiver injury as well. Therapists are uniquely challenged to teach patients to do the movements for themselves, to facilitate normal movement, and to perform a minimum of 10 to 15 repetitions of a movement, even for basic strength, let alone the hundreds of repetitions needed for neuroplasticity and motor learning. The research shows that functional outcome is related to intensity, repetition, and duration of therapy minutes. This can make a huge difference to a patient. Functional level can determine if they can go home or to rehab, or if they will be in an extended care facility. Functional level achieved can determine if they can return to work or to prior family responsibilities. Mobility matters because people matter. Inspire Outcomes has developed a new and innovative solution to the challenges faced by therapists, a complete mobility system that provides therapists with multiple options to safely and effectively treat their patients to maximize mobility. Although there are many single-function slings currently available, from limb slings to turning slings, sit-to-stand slings, and a variety of ambulation harnesses, there are important limitations for rehabilitation with current options. First, therapists perform multiple movements within one treatment, which could require 2 to 3 different slings. Second, many of the slings have been designed to move patients passively, where therapists seek to maximize patient participation. Often, the standard sling sizes do not fit the patient's diverse body shapes adequately for active transfer tasks. This can be a source of frustration for many therapists, and indeed, surveys of therapists have identified sling inadequacies as a key limitation to the use of safe patient handling and mobility equipment in rehabilitation, citing that the slings often do not allow them to do what they need to do with their patients. As a result, therapists continue to get injured at an alarming rate. These injuries result in decreased quality of life for therapists and altered treatment interventions with more in-bed and sitting activities rather than active transfers and ambulation activities for their patients. The UMCS is truly a universal solution that will fill the gap for rehab professionals. Inspire Outcomes has taken feedback from therapists all over the nation and developed the UMCS specifically for therapy. Multiple bed mobility solutions are available, including bridging, rolling, and a brand new solution for side-lying to sitting tasks. These can be done with ceiling lifts as well as floor-based lifts, allowing the therapist to cue and facilitate the patient rather than lifting them. The beauty of using a lift and UMCS combination is that you can have the patient work in any range and perform repetitive movements to strengthen and increase their endurance without risk to patient or therapist. The UMCS also provides alternative methods to perform supine to sit without rolling or reverse recovery back to bed if needed. Recall the manual transfer with our patient Tom. By removing the fear and anxiety during transfers, he is more willing to participate when supported by the UMCS. The risk of falling during sit-to-stand transfers has been eliminated, and we are able to partially unload to train non-weight bearing on the left, gradually reducing support as the patient masters the skill. The UMCS can be used with multiple lift options, which provides unparalleled versatility for sit-to-stand training, where we can train safely on liftoff without fear of the patient falling forwards. The UMCS allows you to perform any transfer task through any range. There is no longer a need to switch slings from sit-to-stand to ambulation. Just change the function by moving the straps. The UMCS covers multiple sling sizes. The pelvic belt spans patient girths from 28 to 60 inches, with full adjustability to get a snug fit for patients of many shapes and sizes. The innovative mobility system allows therapists to add extra support wherever needed, for example, under the ischial tuberosities during sit-to-stand, to stop the sling from riding up and achieve a more normal movement trajectory. Patients of size can be particularly challenging. The UMCS is certified to 400 pounds and to a girth of 60 inches, although of course the therapist will ensure that the body mass distribution of the patient is always properly supported. The UMCS has more lift compatibility options than any other product currently available on the market. Imagine being able to confidently treat patients in 4-point and other developmental positions, without worrying about how to lift them back up if they cannot get up by themselves. The UMCS opens the door to many treatment techniques that we might not otherwise try with heavier or dependent patients. Just one UMC system gives therapists the opportunity to increase the diversity of treatment options across all environments of care. Another brand new concept with the UMCS is the use of bungee cords to add assistance or resistance. Just add the bungee straps along with the rigid straps, adjust the length and provide extra spring to any transfer activity. The unique design of the Universal Mobility Coach system means the thigh and torso supports double as limb supports, further providing versatility and value. The UMCS is fully wipeable with an approved disinfectant and can also be laundered to kill multiple drug-resistant organisms. The UMCS offers brand new solutions for active patient participation in activities of daily living. The easy donning and doffing of the thigh supports allows lower body clothing management while keeping the patient fully supported. For the first time, we have a mechanism to let patients safely practice several repetitions of a lower body dressing task. In this use, the lift is not needed. The straps of the UMCS are connected to installed grab bars or supports on the wall. We can now allow our patients enough time to successfully complete their ADL tasks. The lift and UMCS provide as much as, but not more than, the support needed for the patient to complete the task. This patient's knees began to buckle, so the lift was raised to provide more support. With the additional support, the patient had time to finish washing her face. What a difference it makes to our patients when they can complete tasks, even patients who have impairments that slow their processing ability. The beauty of the Universal Mobility Coach system is that the therapist decides what techniques to use. The therapist decides what lift to use and how much or how little support to provide. The UMCS is designed to have maximum access to the patient while providing optimal support. Each task and function can be customized to each individual patient for optimal patient participation. The value of the UMCS is multifactorial. If we estimate value by the slings that can be replaced, in the therapy department, by just one UMCS, the equivalent amount is upwards of $3,000 to $4,000. If our consideration is that UMCS will meet the needs of the therapists and be utilized more frequently, the value may be the prevention of a therapist injury, with the average cost being approximately $15,000. If our value perspective lies in patient outcomes, the UMCS can lower fall risk, which can lower cost by about $20,000. The UMCS will also promote more timely functional recovery and could help lower length of stay, with 1 day in a hospital approximately costing about $1,000. No matter which way you look at it, the UMCS is a must-have for all therapy departments. Ultimately, the value you will bring to your patients through optimizing their mobility to improve the human experience is priceless. The Universal Mobility Coach System is a must-have for safe patient progressive mobility in rehabilitation. Brought to you by Inspire Outcomes, because people really do matter. For more information, or for a quote, or for a demonstration of the Universal Mobility Coach System, please contact us at peoplematter@inspireoutcomes.com.